Welcome to our lecture on safety injuries, first aid, and disabilities. We have various safety concerns in the school setting, some of which include road traffic accidents, falls and slips, burns from exposure to open flame or fire, drownings, poisons and toxins, heat exhaustion and heat stroke, lacerations, cuts, abrasions, and puncture wounds, exposure to environmental allergens, sports injuries such as collisions, falls, and head injuries, intentional injury and violence from bullying, physical altercations, and violence in the home. So as we go on through these various harms that can reach schools, we would like to differentiate the two terms hazards and risks. So a hazard is anything that can cause harm, damage, or adverse effects to people in a workplace, while a risk is a likelihood that a person is harmed by a hazard. It's possible to have a hazard in a school, but a low risk of injury or harm if the hazard is properly removed or Here are some categories of hazards. The categories include biological, chemical, physical, safety, ergonomic, and psychosocial hazards. Biological hazards would include viruses, bacteria, fungi, animals, and sources of infection. So there would be a high risk of exposure to this hazard if there is an open sewage, vermin, infectious body fluids, and COVID-19. Chemical hazards are hazards that can cause damage, irritation, burns, or other damage if used incorrectly. Some of these hazards would include muriatic acid or bleach. Physical hazards are those environmental factors that can cause harm to a person even without direct contact. One example of this would be extremely high noise volume in one place, or excessive heat in a lab or a kitchen, or radiation from equipment. Safety hazards are factors that cause an unsafe school or work environment. Sometimes they're included under physical hazards. One example would be an exposed live wire, or spills and puddles that can result in tripping, and improperly stored objects that can fall during an earthquake. Ergonomic hazards are physical factors that can result in musculoskeletal injury, such as poor posture, improper lifting, poorly designed chairs, desks, and work table setups. Lastly, we have psychosocial hazards. These are the situations that can cause mental or psychological harm to one's well-being. And some examples of this would include bullying, sexual harassment, stress, adjustment issues, and other psychosocial hazards. Let's talk about the hierarchy of controls in order to remove the risks associated with a hazard. So we have from most effective to least effective, elimination, which physically removes the hazard, substitution, which replaces the hazard, engineering controls, which isolate the workers from the hazard, administrative controls, which change the way that work is performed, and last but not least would be PPE, or personal protective equipment. What are some basic first aid measures that can be implemented in the school setting? Bruises are reddened or blue-black areas of skin that change color or fade over time. This is usually in a matter of days for healthy children. First aid would include applying an ice pack in a towel for 10 minutes at a time for the first 1 to 2 days after the injury. It's important to rest the bruised area as much as possible and to watch out for painful lumps or swelling or repeated unexplained bruising, which would warrant a referral to physicians. Next, we talk about sprains and strains. Sprains involve the twisting or stretching of a joint, while strains involve the sudden stretch of a muscle. These do not result in obvious deformities of the injured body part. If there is a deformity, pain, and immobility, consider a fracture or a broken bone. First aid includes the mnemonic RICE, rest, ice, compression, and elevation. So for resting, we should not allow our students to walk around on a sprained or strained leg. We need to ice the painful area for approximately 10 minutes at a time. Compress and give comfortable support using an elastic bandage or a sling, and to elevate or lift the affected area as much as possible. Let's talk about fractures and broken bones. If the patient presents with difficulty or finds it impossible to move, the appendage is swelling, or there's the deformation of the affected part, let's consider a fracture. In some cases, the deformity is only seen on an X-ray. Either way, it needs medical attention and hospital referral. First aid would include stopping the bleeding with a clean cloth or a gauze, immobilizing the injured area using a splint, avoiding moving or pushing back any visible bones, and using ice packs wrapped in towels to relieve the pain. In terms of head injuries, accidental collisions, falls, and sports injuries are the most common causes of head injuries in schools. This can result in bleeding or loss of consciousness or blacking out. Even mild head injuries need to be observed very carefully because it can take hours or even days before signs of serious injury are obvious. First aid would include allowing the person to rest for several minutes. We should apply a cold compress to the site of injury to reduce the pain, stop any bleeding with direct pressure, and observe them for some hours, never leaving them for a long period of time. It is time to refer to the hospital if the person is sleepy or cannot be woken up, not responding to conversation or questions, losing clear fluid or blood from the ears or nose, vomiting, experiencing numbness or weakness in one or more parts of the body, or having a seizure. For allergies, here are the most common causes of allergies, including seafoods, nuts, food coloring, dust, animal dander, insect bites, pollen, and some chemicals. Symptoms include rash, itchiness, puffy eyes, body discomfort, and may need emergency medical attention for symptoms like throat swelling, chest tightness, and difficulty of breathing, also known as anaphylaxis. First aid would include removing the person from the source of allergy if possible, keeping the affected person calm because anxiety worsens allergy symptoms, using over-the-counter hydrocortisone and cold compresses for the rashes, seeking a consult for anti-allergy medications such as antihistamines, and if the person has a severe reaction or loses consciousness, we should bring the person to the hospital immediately. Keep the feet elevated, loosen tight clothing that can restrict breathing, and cover with a coat or a blanket. Now let's talk about heat stress-related illness such as heat exhaustion and heat stroke. Exposure to excess heat, especially in the absence of adequate intake of fluids, is the definition of heat stress-related illness. So it presents with excessive sweating, faintness and headache, thirst, and elevated body temperature. If it progresses to heat stroke, a patient can lose consciousness or have seizures. This is the most serious form of this type of illness and is characterized by the body losing its ability to control its temperature. So the first thing we could do is to take the person to a cool and shaded place, cool the person with cold water or ice, and provide liquids if the person is still able to drink. Importantly, in here, we need to seek medical help or call emergency services. All patients with heat stress related illness need to be evaluated for significant long term effects of this emergency.